Hello, my name is Madiha, so I'll be talking about the history of REBT. So first off, what is REBT? REBT stands for Rational Emotive Behavior Therapy or theory that is developed by Dr. Albert Ellis in the 1950s. He was motivated in part of his desire to create a more effective psychotherapy that addressed some of the shortcomings of psychoanalysis. So, although REBT is considered as the byproduct of CBT, which is cognitive behavior therapy, Dr. Albert Ellis is regarded as the pioneer of CBT that influenced Aaron Beck, which is the founder of CBT. This therapy was known as rational therapy until it was expanded to include emotions and behaviors. So REBT is evolved as an alternative to psychoanalysis. REBT is an action oriented approach that focuses on teaching people how to manage their emotions, thoughts, and behaviors in a healthier, more realistic manners. So, for example, as we know, problems can arise when people have irrational beliefs about themselves or the world. He believed most people are unaware that they have these self perceptions that are irrational and have a negative impact on their life and how they behave in relationships or how they react in the situations. So, according to Ellis, these negative emotions and will cause people to engage in self-destructive behavior and affect their life goals, their relationships, and many more. So once identified and understood, these negative behaviors can be changed to a more positive and productive behavior and allowing us to develop a more successful personal and professional relationships. So that's all from me. Thank you so much. I'll pass it to the next presenter.
Hi, my name is Balkis and I will talk about theoretical assumption under the rational emotive behavioral therapy. It is believed that REBT are based on our goals, purposes, and rationality. Dryden says that our way of rational thinking can help us achieve the goals and purposes that we have set, and our irrational thinking might be the obstacle from achieving the goals. For Bandura and Alice, they believe that to face and solve our issues in a better way, we must approach it as humanly possible by understanding how it affects our emotions and feelings. Next, Alice also says that our rational belief can encourage people to be a better version of themselves, while irrational belief will affect how the person evaluates and solves the problems. Besides that, our rational and irrational way of thinking are actually our basic biological tendencies, which means it is always inside of us, and it also influenced by our environment and surroundings. The last one is fundamental disturbance, where there are two types of disturbance, which is ego disturbance and discomfort disturbance. Ego disturbance is more about blaming themselves and feel like they are not good enough, and discomfort disturbance is when a person did not get what they want. They start to feel restless and stressed until they get what they wanted. This disturbance can be controlled by the person itself on how it will affect to them. Thank you.
Alright, so for rational emotive behavioral therapy, the techniques that used in this can be divided into three, which is cognitive techniques, behavioral techniques, and emotive techniques. Under these three categories of techniques uses, there are various of activities or skills, approaches that can be used a part of it. For example, to name a few under the cognitive techniques, there are approaches like disputing irrational belief and also changing the client's language, altering the client's language, in which where in REBT there it's often related with the irrational thoughts like, as a person I must be good at everything, and or maybe we have a thought that others should treat us in the best way, and so on. So uh, one of the things that we are trying to tackle using our EBT is to change the client's language, like to look again into those rational thoughts, like are those must and shoulds are relevant, does it bring good, and so on. Next one, for the emotive behavioral techniques, there are a few elements that we can incorporate in this techniques. For example, using the basically emotive techniques is what means to be used as a vibrant, like brings out impact. So for example, one of it, Albert Ellis suggested to use of humorous songs in which it uses to help the patients to what it helps the patients to, like, because he said in one of the in previous literature, it was suggested that most problems was caused because people was too take it too seriously. So he suggested to use humorous songs, and that is only one of the many other activity or approaches that can be done in REBT in terms of emotive therapy, in tackling you know the in tackling the issues. Yes. And lastly, for the behavioral techniques, it includes extensions of the behaviors. So basically, this behavioral techniques focuses on behavior modifications of REBT. So basically, a few techniques that can be used is the extinctions of the behavior extinctions, client counselor contract, and also reinforcement. So reinforcement, to name a few, is it's part of the open conditioning, which is you do good, you get one reward, and it's basically introducing reward and removing something as a punishment. Yeah, removing something pleasant is known as punishments, and introducing something pleasant is can be said as the rewards, and it's part of the structures for reinforcements. Thank you.
I'm going to talk about the application of this theory in resolving a client's problem. The model that we can use in REBT to resolve a client's problem is ABCDE, which is A stands for activating event, B stands for belief system, which means the irrational thoughts the client is having, C stands for emotional consequences, D stands for disputing the irrational thoughts, and E stands for cognitive and emotional effects. Or we can also say that the counselor will help the client to adopt the new effect. So, the example of situations where we can use this theory is where there's this girl called Jenny. She's a high school student, and she felt depressed ever since she got into a fight with her best friend. And the best friend is the only person she ever had. Like, she don't have any other friends, and they are friends since childhood. So she went to a counselor, where the counselor identified uh, the activating event, which was the fight she was having with a friend. Then the counselor also helped Jenny to identify her irrational thought, which was her think her thinking that her best friend must have hated her by now, or she also believed that she won't have any other friends other than the best friend, since they only both of them were friends since childhood. And then she also believed that she's the best friend since she fought with the only friend she had. And then to see the emotional consequences of this of her irrational thought was depression. So the counselor helped her to identify that, and after that he followed the D method, which was disputing Jenny's irrational belief by asking her if her beliefs are logical and helpful, or irrational and or self-defeating. And they ended up finding out that her irrational thoughts are irrational and self-defeating, because um, the this is the only fight they ever had. So her best friend won't probably hate her for this one fight. And then she also might get a lot of friends because she has a nice personality. She's a good person. Not only that, she's also not the one who always causes the problem. So the irrational thought she was having was unnecessary. After disputing the irrational thought, the counselor helped her to adopt a new effect, which was making her to realize that she was having irrational thought, and all she has to do is apologize to a friend and talk it out with her. The next situation where we can apply this theory is where a young girl named Amy had a mental breakdown because she felt like she wasn't being a good doctor just because she failed in an examination. So she went to a counselor where the counselor helped Amy to identify the activating event, which was her mental breakdown for failing in an examination. And next, her irrational thought was that she's not a good daughter because she brought her parents down, and she must have passed the examinations. That's what causes the entire mental breakdown she was having. And then to dispute the irrational belief, the the counselor told Amy that just because she failed the examination doesn't mean she is not a good daughter. There are a lot of other ways that she can prove that she's a good daughter. And then lastly, um, to help Amy to adopt a new effect, the counselor advised Amy to uh, try to do well in her upcoming examinations. And then the last situation where we can apply this theory is where a boy named Josh felt so anxious about working at a new place, and he was having trouble to calm himself down. So he went and met a therapist, where the therapist helped Josh to identify the activating event, which was um, his anxiety for his thought of working at a new place, which causes his anxiety. And then his irrational thought that causes the anxiety was he thought that people won't like him because it's a new environment, and he thought that that environment won't be suitable for him. So to dispute the irrational and anxiety which made irrational thought which made him anxious, the therapist told him that there's no particular reason for him to feel that way since he is an amazing person. And um, the therapist uses uh, the last model in ABCDE, which was uh, helping the client to adopt a new effect, which was the therapist told Josh that there's no reason for him to be anxious about working at a new place, and all he has to do is just to give his best, and everything should fall in place. So these are the three situations where this theory is applicable.
Hi, madam. My name is Lisa. So I'll be explaining about the criticism in RBT. So first we'll start with the advantages. So the first advantage will be to get rid of the ideas of the actually motivate them, like negative thoughts. So by acceptance and awareness. So by acceptance awareness, RBT could bring acceptance and awareness. So like for example, awareness such as we could aware that the outcome of an event is not in our hand. It could be, if we try, we could change the outcome. So for example, if a person think they are unlucky, so if they're unlucky, nothing gonna happen in the right way, so the belief that they have, they are unlucky and nothing gonna go right way, it could be it could be one of the reason that the thing is not going to be perfect. So that's why acceptance and awareness could bring in RBT, could make them realize that everything can change by our own effort. So second one is the RBT is a goal oriented method, so which is how we adapt it to our belief. So it's like we have a goal and then we have to, we have to achieve the goal by any chance. We have to make sure we realize that we could achieve the goal by our own effort. So for example, it's like realize that the way you thinking actually making the things to the way you're thinking. If you have a negative thought, it could make a negative outcome. So if you have a positive thought, it could improve the quality of your life, like by making a, it could be a positive outcome. So RBT could be that advantage, one of the RBT advantages. And the third RBT advantages is RBT can seem to be an extreme form of psychotherapy, particularly when combined with the medication. RBT works with the individual and allows them to have a strong involvement in the therapy process. So it's like the individual need to have involvement themselves. So it's the individual, if since it's involved with the individual, so the role of the therapist is less compared to the client. So the client have to work on them, they have to do homework, so it's like a kind of, it's in your hand, so you are the one who's going to make a decision. So that's one of the advantage of RBT also. And RBT also seems to be a model of model of model of psycho educational model. So it could be an adapt their way of thinking and long term is positive. So that's one of the advantages. So now we'll move on to the limitation that RBT can cause to RBT can cause to a client. So first of all, is cruel to client. So as we know, RBT need a homework, we need a constant belief that we can change something. So so it could be over, pressure to someone, it could be overwhelming for someone. So like emotional strategy could oppressive them. For example, like students, kids, like they are around 12, even though it's school students, they need they can't work on RBT therapy because they're not even mature yet, they're not cognitively, they are lack of maturity, right? So which is very hard for them to change the way of their thinking. So need to find another alternative way lah. So we must pick our client carefully when come to RBT, because it's not always beneficial for everyone. Sometimes it's not beneficial for some clients. Some clients probably it look like overworking them. Probably the client need nothing, not like telling them, oh, you need to change this way. So probably the client influenced by other factors also. So second limitation is cultural point of view. So as we know, culture and religions are more likely to influence our daily life. So for example, when come to RBT theory, it's more like a Western culture therapy. So it's shaped it's based on perception and beliefs. So for example, it's those who believe superstition can cause our, superstition can influence us. For example, if anyone know that 7:30 time is like a unlucky time for Indians mostly. So they know 7:30 usually unlucky time. So for example, if you have something important event coming on 7:30, something good thing have to happen on 7:30 a.m. or p.m., it could they would see it as an unlucky thing. For example, you have an interview at 7:30, so they will think, oh, I'm gonna fail 7:30, of course I'm gonna gonna fail this interview, I'm not gonna select it in this interview. So this kind of behavior, this kind of culture influences and religion influences can cause the patient the belief. You can't change a person culture easily, that easy, because we are not from Western, we are Asians, Asians have strong hold to cultures and religions. So when come to Asian patients, RBT could be less effective to Asians when come to you should touch in the cultural points. Sometimes we also, as a therapist, we don't know it's a cultural view. For example, like I told you just now, 7:30 is a bad time for Indians. Probably most of us don't know, but this is for some people, some families have different kind of rules and regulations. So this all could influence the patients. So lastly, the outcome of RBT can be unsuccessful for serious psychological illness. So for example, like schizophrenia or any kind of psychological disorders that extreme level. So because if not, RBT is not a quick fix, it's not a fast treatment, fast therapy. It's going to be taking a long time, long process. It's going to take probably months. But some patients need immediate attention, some clients need immediate attention, some clients need immediate help. So for that, I think RBT can't be reliant, because it's like taking a long time, right? So, and also our social life also can influence therapy, as I said just now. Social like culture, how can influence our social life, also can influence, like our parents, like our friends. For example, our parents are a person, if our parents are those who look down to those with low status, so we will influence by that thought, and we will have that kind of thought when we come to RBT session. When we want to have to communicate with those, when to get rid of the irrational belief that low class people are bad people, which is hard, because you are influenced by your family, daily life, daily you're going to see your family, so you're going to influence by that idea and the thought. So its effectiveness is highly reliant on the client dedication in to the theory to the therapy. So that's it. So thank you.
Hello everyone, my name is Noatir binti Faizal. I will be talking about conclusion. So in conclusion, what we learn is that REBT, Rational Emotive Behavior Therapy, is one of the cognitive behavioral therapy, or so-called CBT, which is developed by Albert Ellis. And we learned that REBT is an approach that helps people dealing with irrational beliefs, and also learn how to manage their emotion and behavior in more realistic and healthy way. Next, we learned that from our EBT, our emotion mainly come from our beliefs, and evaluation, interpretation, and reaction towards our life situation. We also learn that through the self-talk, we learn and invent disturbing beliefs and keep ourselves feeling disturbed. Then the client will learn how to identify the irrational beliefs and replace the beliefs with a rational cognition, and stop the thinking, blaming, and repeating the false beliefs. The therapist will also help the client in encouraging them on discovering their irrational beliefs, and also show connection between irrational beliefs, between how irrational beliefs can lead to emotional disturbance. And also and then from what we learn, that every therapy has limitation, and for REBT limitation is that Albert Ellis ignored the past, and while CT, which is cognitive therapy, focus too much on positive thinking and deny the past, and also ignore the unconscious factors and emotion. That's all for me. Thank you.